Did you know less than 1/3 of out-of-hospital sudden cardiac arrest victims receive bystander CPR? CPR stands for cardiopulmonary resuscitation. Now, wouldn't you want to increase that number by learning CPR? It is a necessary skill that I think everyone needs to know to help your community. Today, I'm going to teach you the steps of CPR. First, you want to make sure that the scene is safe so you don't get hurt. Next, ask the patient or victim if they are okay and if they respond to you. Ma'am, are you okay? There's no response. So get somebody to call 911. Can you call 911? Kneel on the side of the victim, and if there is no suspected neck injury, place one hand on forehead and the other under the victim's chin. This is called the head tilt chin lift. This is so that the tongue does not block the airway. If you do suspect a neck injury, then you're going to place both hands behind the jawbone and thrust forward. This also does the same thing. You're going to look inside the patient's mouth to check for any airway obstructions, like food or anything. And if you see it, then you can remove it. If there's nothing, don't do a blind sweep just to get anything out. You're going to check for and listen for breaths or breath sounds for 5 to 10 seconds. 1, 2, 3, 4, 5. And I did not hear any breaths or see the chest rise. So I'm going to hold the nose and give 2 rescue breaths. I'm going to also check for the pulse on the person's neck underneath the jaw for 5 to 10 seconds. 1, 2, 3, 4, 5. I did not feel a pulse, so I'm going to make sure that the person or victim is laying flat on his or her back on a hard surface, and I'm going to start CPR. I'm going to put one hand in between the nipples and halfway down the chest, and I'm going to do 30 compressions, 1.5 to 2 inches deep, and hard and fast for about 2 per second or 100 per minute. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then I'm going to give 2 breaths. And you'll repeat that until emergency medical personnel get here. Today, I went over the steps of CPR so that you yourself can perform it in case of an emergency. Remember, I'm not a CPR teacher, but I've taken the class. So if you want to learn the steps and have it hands-on, you need to take the class. Effective CPR can double a victim's chance of survival. If you ever have to do CPR, remember, the 911 operator will walk you through the steps if you forget. I hope you will take this class and save someone's life.